I saw this question asked on Facebook and figured I'd ask AI, if methadone is free to addicts because they have a disease. Why is chemo not free to cancer patients? And here's what it came up with.
The disparity in access to free treatment for addiction, for example, methadone, versus cancer, for example, chemotherapy, stems from a complex interplay of healthcare systems, funding priorities, societal perceptions, and economic factors. Here's a breakdown. 1. Healthcare system structure. In countries with universal healthcare, for example, UK, Canada, both methadone and chemotherapy are typically covered, though wait times or administrative hurdles may exist. In systems with privatized or insurance-based care, for example, US, access depends on insurance coverage, income, or specific programs. Methadone might be subsidized through public health grants or harm reduction initiatives, while chemotherapy costs often fall on patients, depending on insurance plans. 2. Funding priorities. Addiction treatment, like methadone, is sometimes prioritized as a public health intervention to reduce broader societal costs, for example, crime, HIV transmission. Programs may receive targeted funding from governments or NGOs. Cancer treatment is generally more expensive and may strain healthcare budgets. In non-universal systems, cost sharing, for example, co-pays, deductibles, shifts financial burdens to patients. 3. Societal perceptions and stigma. While addiction is medically recognized as a disease, stigma persists, potentially influencing policymakers to frame treatment as a social responsibility, to mitigate public harm, rather than individual care. Cancer, by contrast, is less stigmatized, but its treatment may not receive the same urgency in funding debates unless driven by strong advocacy. 4. Economic and logistical factors. Methadone is low cost compared to chemotherapy, making it easier to subsidize. Chemotherapy involves expensive drugs, specialized staff, and infrastructure, complicating universal access. In some cases, pharmaceutical pricing and patent systems inflate chemo costs, whereas generic drugs like methadone are cheaper. 5. Political will and advocacy. Harm reduction programs, for example, methadone clinics, may gain support for their role in reducing crime or healthcare costs, appealing to policymakers. Cancer treatment, while critical, may lack equivalent political momentum unless driven by patient advocacy groups or public pressure. Key takeaway: the availability of free treatment depends on how a society structures its healthcare, prioritizes diseases, and balances economic constraints. While both addiction and cancer are medical conditions, systemic inequities and policy choices often lead to differing levels of access. Advocacy for universal healthcare or reformed drug pricing could help address such disparities.
Uncle Scruff, what are we doing? What are we doing?